And we are back with more What's Now. It's hard to believe that the summer is ending and the school year will be starting very soon. In fact, I spoke with a physician recently all about the importance of making sure that your children are up to date on their vaccines. Here's more.
Although summer is just heating up, the first day of school sneaks up on families every year. With the pandemic disrupting annual preventative health visits, childhood vaccination rates have been declining. Now, the number of children with required shots nationwide is falling below herd immunity, raising the risk for disease outbreaks as students head back to school. So, what does the medical community want parents to know about the importance of getting their children up to date on routine vaccines? Well, family physician Dr. Christopher Scuderi is joining us to discuss the importance of getting kids up to date by adding vaccines to your back to school checklist. Doctor, thanks for joining us today.
Thank you so much for hosting me, Christine.
Dr. Scuderi, why is it important for parents to follow their child's immunization schedules and ensure they're up to date on their vaccines, especially before heading back to school?
So I want to let parents know it's important for a number of reasons. The first is there's no better time than now to ensure that your children are up to date on the recommended immunizations. The second is, as a family physician, I have great concerns nationwide that there's many children out there that have missed their well child visits due to the COVID-19 pandemic. And as a consequence of this, these children are falling behind on their immunizations. And so I think a great reminder for parents is to remember that these childhood immunizations are one of the greatest life-saving medical interventions in history. If you look over the past 20 years, childhood immunizations have saved 37 million lives around the world. And so it's an important step that we often forget about.
The phrase herd immunity has become part of our daily vocabulary now, but what is the importance of it?
So this is a phrase we've heard a lot during the COVID-19 pandemic. And so to break it down for listeners, the herd immunity occurs when a large portion of a community becomes immune to a specific disease. And that makes the spread of the disease from person to person unlikely. And why this concept is important is because if the level of immunity in a community drops just 1% below the threshold needed for herd immunity, that community may be at risk for a devastating disease outbreak. And an example of this is with measles. In the year 2000, the United States declared that measles was eliminated. Yet in 2019, we had over 1,200 cases of measles in the US in 31 different states. And so it's important that everyone does their part in keeping that herd immunity up.
If we want to be sure our children are returning to school fully vaccinated, what should our timeline be, and when should we be scheduling these appointments?
So as a parent, I would tell you now, I know that summer gets busy. It's easy to kick the can down the road, but just it's important while you're thinking about it to take this step to protect your children. And there's a few reasons why it's important. One is that the weeks right before school start tend to be some of the busiest at physician offices. The second is some of the vaccines that your child may need to be given in series, so they may need a second dose. And so if you want your child to have peak immunity before they go back to school, scheduling the visits now would be recommended. The third is if there's anyone listening that may have, any questions about vaccines or concerns that may have come up during the COVID-19 pandemic, it's a great opportunity to talk to your family physicians about these concerns.
Children ages 6 months to 18 years are now eligible for the COVID 19 vaccine. However, the dosage amount and efficiency differ across age groups. Can you break it down for us?
Sure. So they now have been approved for ages 6 months through 5 years. And so there's two vaccines that were approved in this group. The first was Moderna, and Pfizer is also with them. And so there's a couple key differences between these two vaccines I want parents to be aware of. With the Moderna vaccine, it is a 2-dose series that's given 4 weeks apart. With the Pfizer vaccine, it's a 3-dose series. And so children will receive the first dose. 3 weeks later, they'll receive the second dose. And then 8 weeks after that, they'll receive the third dose. And it's important for parents to remember that that third dose is not a booster. It's part of the primary series to prevent COVID-19. I would encourage all parents to know that these vaccines are fractions of what are given to adults. And so they've really tested these vaccines to make sure that they're safe and effective in this age group. Another thing that I want to remind parents is that if you have a child at home that's 5 or older, and it's been 5 months since they've received their last vaccine, they would be due for a booster, and we recommend that they get that.
Many parents have questions about safety of the COVID 19 vaccine for children. What is your advice to those parents?
So I remind parents that COVID is very unpredictable, and we're unsure of which children are going to have severe disease, long-term COVID, which children may need to be hospitalized, and which children may die from COVID. And so we look at the COVID vaccines. They're a terrific tool to prevent severe disease, hospitalization, and death. And so when you're looking as a parent, how can I best protect my child? The COVID vaccines are one of the best tools to do that. And so if you have any questions about the vaccine and is it right for your child, make an appointment with your family physician. They'll be glad to discuss it with you.
And where else can we go for more information about everything we've talked about today?
So there's a fantastic website, familydoctor.org/vaccines. It has a lot of information about commonly asked questions about vaccines, and it's accessible anytime. And so it's a great resource for parents.
Well, thank you so much, Dr. Christopher Scuderi, for joining us today. Really appreciate this important information about vaccinations, children, and heading back to school.
Thank you so much for having me on today.